quite very simple. It's going to be a kindergarten presentation so that you understand the basics properly. That's when the experts explain to you, it'll be more easily understandable. Okay. Now, the few terminologies which are very important for running is, I'll be talking under the same headings. What is cadence? What is striding? What is understriding, normal striding, overstriding? What are the most important types of foot landing when you're trying to run? And what are the most dangerous and safest foot angles that you're going to talk about in runners? What is a zone, safe zone for running for different type of runners? And what are the most important metabolism that a runner goes through when he's running? Now we have three types of runners. One is casual joggers, then you have long distance marathon runners, and you have sprinters. So their metabolism is totally different, their style is totally different, and we need to understand each and everything properly to get the maximum efficiency from them. Cadence is nothing but the number of steps per minute. For a jogger it's small, for a marathon runner it's little long, whereas for a sprinter he takes maximum number of steps, tries to get the thrust as much as possible. So this is very important, and it varies according to the style. And striding, you need to make sure when you're running, your foot or the heel strikes exactly below your hip. Understriding is where you take too many steps. Don't do that. You're going to strain yourself a lot, and you're going to waste your heart metabolism. You're going to increase or strain your heart rate. Same way, this is called understriding. And overstriding is when you stretch a lot, and you see the foot is striking the ground in front of the hip, not below the hip. So that's understriding, and this is a normal stride you have to maintain when you're running, let it be a long distance running or a sprinting. This is the most important thing. What are the type of foot landing? Now, for a forefoot landing, which is commonly seen in sprinters, and midfoot landing is commonly seen in marathon runners, that are long distance runners, and hindfoot landing is seen in joggers.
Striker. Gosh, she
That's
really runs on her
forefoot,
toes.
and then you have the midfoot landing. All right.
You've heard the terms.
I'll be playing it once again.
Heel
You have the
striker.
hindfoot
She
landing,
really runs on
forefoot
her
landing,
toes. That's
and then
perfect.
the midfoot
Midfoot
landing.
strike.
Right? This
You've
is
heard
very
the terms
important to
so
do the
far.
biomechanical analysis of the foot.
Own run-
Take a closer look at it, not just Usain Bolt, all the sprinters. In slow motion, where are they landing? It's just the forefoot, and that's the one which gives the maximum thrust. And how much is the follow through? Once the foot lands on the ground, it reaches up to their buttock, and that's a swing that they get, and that's the one which gives the thrust and the momentum to propel further. This is very crucial for a fast or a sprinter. Now the same thing, why is Usain Bolt so special and different from others? Because all the sprinters are taking the same steps. Their cadence is the same. All right, their foot strike, everything is same. But why is Usain Bolt different? If you take a keen look at his stance and his thrust the moment he gets from the bullet strikes, he takes beautiful steps, and at the same time, the number of steps he takes and the kind of propulsion that he gets with each step is much better and advantageous than the others, and you will see it right now. Don't take a look at Usain Bolt, look at the second runner. He is running at the same pace, but with each step, Usain Bolt gets more thrust, which means biomechanically and stature-wise, he is at an advantageous position. So that's the reason why he is getting thrust in each and every step. All right. So everyone has got the great steps, cadence, whatever it is, but the thrust, Usain Bolt is little advantageous. All right. The midfoot landing is classically seen in long distance runners. It can be burning your body fat. Okay, your body fat burns, you sweat, you use the oxygen. That is during the initial phase of running. For example, if you're a long distance runner, the initial 3 to 5 minutes you sweat, and that is aerobic metabolism. Now, anaerobic metabolism is when you exceed more than 15 or 30 minutes, then what happens, there is lack of oxygen. So what does the body do? It takes out the carbohydrates from your body, and that's where the lactic acid builds up. So carbohydrate provides energy, lactic acid deposition happens in the muscle, and that is the main reason why you undergo fatigue and you experience pain in your joints. So the threshold, the very good threshold for a long distance runner is aerobic threshold, which means a long distance runner uses his body fat and there is no lactate buildup, and he can run for how much ever distance he wants. Lactate threshold is where the accumulation happens. That typically happens in a half marathon pace, and when you slightly tend to find or you feel the pain in your muscles, that means, okay, fine, your body is deprived of energy, you have to be a little cautious. And anaerobic threshold is where there is complete buildup of lactic acid, and it's a warning sign, which means you have just limited time or distance to cover. So these are the basic things about running, after which we have the experts who will be explaining to us about the different types, and then we'll have the question answer session. Thank you.